I'm a cardiac surgeon working as a consultant at Kasturba Hospital, Valsad. My key area of focus is adult cardiac surgery and the minimally invasive, or rather than minimally invasive, I call it the alternate access cardiac surgery. Just because in cardiac surgery, I don't believe anything is minimally invasive. When you operate on heart, it's usually never minimal. The risks are always high. So rather than minimally invasive, the better terminology, which many surgeons prefer, is the alternate access surgery. Just an introduction about minimally invasive or alternate access surgery is routine cardiac surgery we perform through a sternotomy. We cut open the breastbone and then we operate on the heart. That way we can directly get access to the heart. But in minimally invasive surgery, we go through right or left side of the chest in between the rib spaces, and we create a window good enough so that we can access a particular part of the heart on which we need to operate. So that's the basic concept of minimally invasive surgery. In a way, we can say minimally invasive surgery transfers the pain of surgery from the patient to the surgeon. That's because after minimally invasive surgery, the patient experiences least amount of or almost no pain. But because the window is so small and the surgeon has to operate in such a way that it is the surgeon who bears all the pain. So today we are going to talk about the imaging, the role of imaging.
Before every successful surgery, planning begins long before the operation theater. Preoperative imaging helps doctors understand the exact condition inside the body. It provides a detailed view of anatomy, abnormalities, and surgical risks. From locating tumors to identifying hidden complications, imaging guides precision. It helps surgeons choose the safest and most effective surgical approach. Better imaging means better preparation and fewer unexpected surprises. Preoperative imaging also improves surgical confidence and decision-making. Accurate planning can reduce complications and support faster recovery. That's why understanding imaging is becoming essential for modern surgeons. Upgrade your surgical knowledge with advanced medical education at Medical Global Academy.
For minimally invasive surgery, one particular thing that we do, since we don't have cerebral saturation widely available, is we put the SpO2 monitor on the right arm. So if the blood is coming from the femoral artery right to the aorta, the arch of aorta, then the right arm is the most distal part of it. So if right arm is having good mixed venous, then it is understood that the brain is being circulated well. So we don't need a cerebral saturation. It is basically, we can say we can use this in place of cerebral saturation. Again, the NIRS monitoring is not routinely used. It is used only in cases where we handle the aortic arch. And if someone is doing a surgery as complex as an aortic arch replacement or some sort of repair on the aortic arch, then it is usually not advisable to go minimal access route, because again, as I told, it is not a minimally invasive surgery. It is just a minimal access surgery, and the risks double if we miss something or if something does not go as planned. So I personally don't remember any center doing such complex surgery through minimal access route. Again, the role of transvisual echocardiography is quite important in management of perfusion in terms of it needs to detect if the LV is distended or not. Now, in heart surgery, the important thing is to keep the heart always relaxed and not let it fill up with blood, because if the heart distends, it leads to myocardial damage, and no matter how good a surgery is done, a distended heart is not going to do well long term. The other important part is while coming off pump at the end of the surgery, since we had
In cardiac surgery, every second can change a patient's life. That's why modern perfusion management depends on precision. And TEE helps doctors see the heart in real time. It guides perfusionists during critical cardiac procedures, helping assess blood flow, heart function, and fluid status instantly. With accurate TEE interpretation, clinical decisions become faster and safer. It can even help detect complications before they become dangerous. That's why learning TEE is becoming essential for modern cardiac professionals. At Medical Global Academy, doctors gain practical knowledge with expert-led learning. Upgrade your skills in perfusion management with advanced TEE training today.